like to talk about my article for the KaiGo certification, that is AI governance in healthcare, protecting patients and the data. So let's assume that we are using artificial intelligence systems as part of our healthcare systems. What are all the benefits? They are able to analyze large amount of data, analyze the patterns of the various vitals of the patients, and analyze x-rays, analyze ECG report, analyze blood reports, and produce very proactive analysis and deep insights in patients health system. So at the same time, it processes a large amount of client specific data, that is patients. So in terms of patients, these data are highly private data, and that may affect every individual, and it may impact their dignity. It may impact their other uh, dependencies. For an example, insurance and other aspects. So the data which is being processed as part of the AI in healthcare is having highest sensitive uh, pattern actually. So it is highly important to protect these data to ensure the privacy is not impacted at minimum. So now, when it comes to the data privacy, the data which are processed need to be highly protected, like data at transit, data at rest, all are need to have their highest security. Data transit means use secured links between the systems when they are transferred. Data at rest means when they are stored in a database or computer storage, use the highest possible encryption to ensure that these are all basic actually. Eventually, when these data are ingested into the AI and processed by the AI elements also need to be secured. So the AI and its infrastructure need to have the highest possible security to ensure the data leakage is not there, not a possibility. So the AI system and its infrastructure to have the highest security aspects to govern the data to ensure that these data are not unintentionally uh, you know exploited or exfiltrated or leaked out of the system. So they should have all the GPDR, UAA Act, these kind of frameworks to ensure the AI infrastructure which processes the healthcare data um, are highly secured, and ensuring that they are being under constant governance from the AI infrastructure perspective to ensure that security and the data privacy aspects of the client data, that is patient's data, is ensured. When it comes to the AI in healthcare, they are comparatively can produce much more groundbreaking results compared to any other industry. The reason is that they can aid the doctors in analyzing the patient's history and patient's predictive health improvement or health decline, and adjust the medicines, the dosage size accordingly. So, and also it can aid in detecting some of the unidentified underlying health issues which is not normally visible to the uh, doctors in a normal analysis. For an example, the breast cancer or glaucoma in the eye, or some of the heart related aspects. This may not be visible with the normal laboratory tests like ECG or blood reports. So such a reports needs excessive analysis by a well-educated practitioner, and that requires a lot of time for those kind of specialists. So now add the AI in the loop along with the doctor. AI also analyzes, and sometimes human oversight can miss particular points in the X-ray or the report. Then this AI systems, which are trained with the specific data to detect such a incidents early on, can point out to the relevant physician or a doctor or related expert. For an example, cardiologist, what is the predictive impact in a couple of months or years that can be identified by these systems much more precisely with the responsible AI use case. And the responsible AI also can point out why such analysis result was given out based on what data. So that also will add value into the knowledge base of such experts in the medical field. That will also complement their approaches to the various patients and the various situations in the patients. So this is a way the healthcare with AI is going to make a more positive impact in the world compared to any other field where AI can ingest more better benefits. At the same time, as I explained earlier, the data again, coming to the data governance is becoming very, very important because these are very personally identifiable information. Leakage of such information can lead to many impact or impacting many people, starting from the patient to the relevant doctor or relevant hospital or relevant healthcare system, all are going to be affected. So it is best advised to ensure the data is protected and the data which is processed as part of the system is always under governance, and there is a human in the loop to ensure the data is protected, data is processed properly, there is the explainable explanations, explainable AI process on the data and its results, so that all these are in hand ensures there is a fairness in the process of the data which is relevant to the individual patients. This is how I'm expecting that the risks in data governance in healthcare by the use of AI can be reduced and improved upon to ensure that there is a fair control on top of the existing healthcare system to ensure that AI is not going to be a major impact in data linkage. Also, the another one approach will be sovereign AI deployment in such a system, so that localized AI deployment with no exposure to internet will reduce the exposure of data to outside. And the data acceleration also can be reduced. These are all the steps that can be taken upon to secure such a data. And the AI in healthcare definitely going to be a game changer in the coming years. Thank you.